Welcome back. You're listening to A Path to Wellness on rhinoonair.com, WSPF-DB.com. And I hope you all have good memories from the 4th.
I did nothing.
You did nothing?
Nothing.
You just stayed around the house and
sat around and did like nothing, watched TV. And saw a few fireworks, natural and then man-made, because a storm went through and there was amazing lightning. And then after that, the city had fireworks all around, so I could see them from my balcony. So I did not have to move, thank goodness.
That's awesome. Yeah, it's nice to be downtown, huh?
Oh, it
Where
makes
all the
a
fireworks
difference.
are being done, yeah.
It absolutely does make a difference. So good to see you, Doc. I know we were off the air last week. So I'm glad that we're back.
Yes, and we're back. That's right. And I hope you remember some of those shows as well that you've listened to, and hope they've been good. So, and I'm kind of just alluding to memory. I'm alluding to, part of what makes us who we are is our memories.
Before you say that, can you please give a shout out to my friend Donna Hayes that will be listening to you this morning?
Absolutely.
And
hi, Donna.
Good. And I'm sure she'll probably remember this show.
There you go. Hopefully there'll be a good memory as well. So, so we're having, we're going through a lot of things in our lives, and a lot of what we learn from and grow from is our memory and our memories. And it's kind of hard to function sometimes if we forget things a lot. And I've been working with a lot of people on these issues, and so I thought it would be a good topic as well for today. Just memory, memory and some of the worst case scenarios that everybody's familiar with, Alzheimer's and dementia, and know if you're just having some short-term memory loss, that does not by itself indicate that you're, seeing early dementia or early Alzheimer's signs or anything like that. But I have been working with several people, quite a few people, on their memory. And some have been actually diagnosed with dementia or Alzheimer's. And, I've seen some amazing results lately. I've been developing a technique using some assisted acupuncture and applying it to memory issues and helping with individuals who've had some real struggles with daily life, who've had especially combinations of short-term memory loss and anxiety. And the anxiety kind of gets in the way quite a bit. If somebody's overly anxious and thinking about all of the details and overly focused on those details and maybe obsessive or compulsive, along with that, about certain things, that can be somewhat overwhelming and take a lot of attention away from, just general everyday issues and things that we keep track of. So anxiety is one of the things that can really get in the way. And if it's stress-induced anxiety, that can be an issue as well. Stress is a big factor in our society. In the United States, it's amazingly prevalent. I mean, it is just huge, huge. Stress is like a regular factor in everybody's lives in the United States. It's a daily thing, and it probably an hourly or minute-by-minute thing for a lot of people. Stress is hard to get away from in the lives of people who are working very hard, don't get much in the way of downtime or vacations. it just builds and builds. It becomes a real major factor affecting our adrenal function, our metabolic function, and our memory. How does that happen? Well, part of how it happens is that the sequence of events leading from the secretion of catecholamines, which are hormones that are produced by the adrenal glands, such as adrenaline, noradrenaline, or epinephrine, norepinephrine, and cortisol. These kinds of things, cause a sequence of events that eventually affects a part of the brain known as the hippocampus. The hippocampus, by way of another similar sounding part of the brain, by the way, which is the hypothalamus. Hypothalamus is responsible for overall hormonal control in your body. But the hippocampus is a section of the brain that is responsible for quite a bit of cognition and memory, particularly memory. And when it is affected by stressors, we tend to have issues with our memory and can particularly see short-term memory issues. So stress is a major factor, and anxiety may be a result of stress. Anxiety may also be a result of other things. It may be a result of one's history. There may be some trauma in one's history. There may have been both physical and emotional trauma. All of these kinds of things that can affect us, affect our memory, and can raise our anxiety levels. So if our anxiety is induced in such a manner, we may be diagnosed with a disorder. Somebody who is obsessive and compulsive, we know about OCD, right? So OCD is obsessive compulsive disorder. A lot of people are diagnosed with that disorder, and that is truly an anxiety disorder. There are many of these kinds of issues that are really rooted in anxiety. And anxiety disorders can be dealt with very well. You don't have to say yes to drugs, unlike Nancy Reagan's advice. If you don't recall what I'm referring to, Nancy Reagan, back in the 80s, ran a big campaign saying, "Say no to drugs." And, so you don't have to say yes to drugs anyway. Now, that doesn't mean that there may not be some route through drugs that are prescribed for specific issues. And there are some people who do better with very specific solutions when it comes to pharmaceuticals. However, the majority of individuals can be helped by focusing on the root cause. When we delve into the root cause, the underlying factors that are actually influencing the responses that we get, such as anxiety, symptoms. Basically, if you're seeing a lot of symptoms, the symptoms can point to the root cause. And we use a lot more than simply the symptoms to figure that out. A lot of the other kinds of things that we use are various forms of lab work. There can be physiological reasons for some of these things as well. So it could be, there could be a tumor in the pituitary or an adenoma. There's a lot of various kinds of formations that can occur that can affect hormones and emotions. However, that's more of a rarity. The majority of these issues come from trauma, stress, this kind of thing. And the issues will continue to evolve And when untreated, especially at the level of the root cause, then they will continue. And even though somebody may be on medication or drugs, to put it bluntly, to address the symptoms, very, very few of those solutions, which are the typical biochemical, allopathic, biomedical solutions, very, very few of them actually address the root cause. So that people are medicated, they feel better, they may behave better, but that underlying root cause is still there, and it can crop up. And quite often the response to any additional signs or symptoms is to simply increase the dosage. And eventually, by getting the dosage up high enough, they subdue those kinds of behaviors or emotions. Yet, again, the underlying cause has not been addressed. And there are some theories where they justify some of the drugs by explaining that theoretically they're addressing the root cause because they're addressing things like serotonin levels or dopamine levels, these kinds of things. Neurotransmitter levels, neurotransmitters affecting emotions and behavior. Neurotransmitters are active in the primarily in the brain and affect one's emotions and thoughts and behaviors at times. Now, cognition is a big part of that as well, and that's where we get into the memory end of it. But it's rather simplistic to say that I actually said mostly in the brain, but it's really not mostly in the brain. For example, the majority of our serotonin, you may be surprised to hear, is not in the brain. The majority of our serotonin is in our intestinal tract. Majority of serotonin we produce in our bodies is not in the brain. So, yes, it is a factor involved in emotions and the ability to rest and relax and these kinds of things. So are some others like gamma-aminobutyric acid or GABA is another one. That's more of an inhibitory neurotransmitter that basically gets in there and helps to block sort of reactivity that we may have. Like we may be somewhat reactive, we may be overly sensitized or overly stressed or overly anxious. And the inhibitory neurotransmitter, GABA, or gamma-aminobutyric acid, has activity that inhibits the reactivity. So it can help to relax us by addressing GABA and finding forms that are available that go through the blood-brain barrier and improve the levels of GABA. And these are natural approaches to medicine that are used to address these issues. So, as you can see, there are many, many approaches and many solutions, and I'm just touching the surface at the moment as I address this. But when we then segue into memory and thought processes related to memory, there are other neurotransmitters we get in touch with. And one of those neurotransmitters is acetylcholine. Acetylcholine is a primary neurotransmitter for cognition and for memory. And in conventional medicine, the primary approach to dealing with memory issues is, again, to treat the symptoms by addressing the neurotransmitters that are involved, primarily, again, acetylcholine, and inhibiting some of the body's own activity. So instead of, triggering the normal production of acetylcholine to make sure there's more available to help brain activity. Conventional approaches are to inhibit the activity of an enzyme. The enzyme is called acetylcholine esterase. Acetylcholine esterase is inhibited by, of course, acetylcholine esterase inhibitors. And one of the very commonly available and prescribed versions of this that's used to help in treatment of Alzheimer's and other forms of dementia is known as Aricept. Aricept is an acetylcholine esterase inhibitor. So let's break it down one more time. So acetylcholine is a neurotransmitter. It's a neurotransmitter that's used for performance of regular cognition or thought processes, simple thinking and more complex forms of thought, and is also involved in the formation or the maintenance of memory. So if memory is starting to fail, or if there are some concerns regarding memory, acetylcholine is increased by way, in conventional routes, by way of using an acetylcholine esterase inhibitor, which is, again, acetylcholine esterase is an enzyme in the brain that eats up the acetylcholine. So basically, once the neurotransmission has occurred, neurotransmitters have fired, essentially the nerves have fired in the brain, the synapses have fired, the acetylcholine is present for a time, and then the acetylcholine esterase comes in and eats up all the acetylcholine that's left over after that transmission. Well, an acetylcholine esterase, acetylcholine esterase is what eats it up. Acetylcholine esterase inhibitor inhibits the action of the acetylcholine esterase, the enzyme that eats up acetylcholine. And by doing so, makes more available the acetylcholine, because your brain will maintain more acetylcholine so that that thought activity can occur more, and so that memories are maintained more. It's kind of similar to the activity in the approach to the activity of selective serotonin reuptake inhibitors, known as SSRIs. These are drugs like Prozac and there's so many of them, but they are SSRIs. Anyway, there's so many of them. There's too many. They're just all blocking things. Maybe I need some help with that. But there are just so many of these serotonin reuptake inhibitors, and then there are others that deal with not only serotonin but also dopamine. And so these kinds of drugs are essentially the biochemical approach, which seeks to essentially mask, you could say, or to inhibit the activity of the enzymes that naturally will go in and eat up leftover serotonin or leftover acetylcholine, and therefore make those neurotransmitters more available. So this is the conventional approach. So there are some things that are missing from that approach. Like, what is missing? And I don't mean what is missing from the approach. I mean, what is missing in the body? What is causing this problem? You know, in Alzheimer's, one of the big areas is a form of plaque known as amyloid plaque. Amyloid plaque is present and tends to block a lot of the thing and interfere with it in such a way that cognition is affected and memory is affected. That's part of what happens with Alzheimer's. And there are other forms as well. But basically, I could say in general terms, the category is dementia, we could say. Okay. Although some categorize Alzheimer's as a third form of diabetes because it has a lot to do with glycation as well. The accumulation of sugars and their effects on the brain can be a part of this as well. And so to address these issues in a more root cause approach, we can look at, well, what allows our body to create the neurotransmitters? What are they made from, you know? And you know, in neurological circles, it's well known that B vitamins are very, very important contributors to neurological function, as well as blood flow and some other things, cardiovascular function, etc. But there are some specific B vitamins that are very important in terms of neurology, and B12 is one. So is folate. But there's one that's often not addressed. And there's a cofactor or a companion vitamin as well, known as inositol. But the one I'm thinking of is choline. Choline, spelled C-H-O-L-I-N-E. And choline is a component of acetylcholine. That's the term, right? Acetylcholine. So another factor involved is acetyl. So what is acetyl? Well, acetyl is a radical and is present in several kinds of nutritional substances. There is N-acetylcysteine. There is acetyl L-carnitine. So there are other forms of nutrition or nutrients that provide the acetyl radical. So then the body can combine the acetyl radical and the choline vitamin, B vitamin, to create acetylcholine. And there are other forms that can be converted within the body, such as phosphatidylserine or phosphatidylcholine. So we can get choline in a more simple form, or we can get a more complex form, such as phosphatidylcholine, which has phosphate and choline in it. Phosphatidylcholine can also be derived from phosphatidylserine, spelled S-E-R-I-N-E. So phosphatidylserine can be converted to phosphatidylcholine, and then phosphatidylcholine can be converted to yield its choline, and then that can be combined with acetyl radicals to create acetylcholine. So by providing the underlying nutrient components, we can then help our bodies, help our brains, and nervous systems create the needed components or neurotransmitters to then enhance or assist the function, the normal function that occurs with neurotransmission. So you can see this is a very different approach. Now, that doesn't mean that it has to be used in an isolated way. You know, I am a believer in integrative medicine. I think that integrative medicine can provide the best solution quite often, where both kinds of approaches can be used at one time and really help people at an optimal level. However, there are often solutions that are not drug-based that can perform even what the conventional medicine approaches or the conventional medical solutions might do. So, for example, there are natural acetylcholinesterase inhibitors. I was talking about acetylcholine being a primary neurotransmitter for memory and for cognition, for thought processes, thinking. Well, there are natural forms of acetylcholine esterase, the enzyme that eats up the acetylcholine, inhibitors. So there are natural forms of inhibitors that inhibit the acetylcholinesterase activity and therefore allow more acetylcholine to be present and to maintain more of a presence in the brain. While simultaneously we can use other natural approaches like nutritional approaches that contain the acetyl radical and the choline, or maybe allow us to derive the choline, such as phosphatidylserine, that can then be converted to create more phosphatidylcholine, and then that provides the choline. Or we could get it in the form of simply the paired B vitamins, choline and inositol, which is another way of getting choline for that purpose. Now, funny thing is, the paired B vitamin that is sort of a partner to choline, inositol. Inositol is also shown to be of great value when we look at anxiety disorders. Some of it is because of its improvement of blood sugar regulation and sensitivity to insulin, so that it can improve insulin sensitivity, so that if someone is insulin resistant, for example, they may be type 2 diabetic, that can be improved with inositol. And simultaneously, it has been shown to be equivalent at the right dosage to the in effectiveness to the drug, which is quite often used with OCD, obsessive compulsive disorder, and anxiety disorder, equivalent to the drug known as fluvoxamine or Luvox. There are studies showing that Luvox activity in terms of helping OCD behaviors can be matched by proper levels of inositol. So you see, we can approach all of these things totally naturally and not be required, it's not necessary to use more harmful derived synthesized chemicals that simply target the symptoms without any real nutritional value or addressing any real deficiencies directly. So there are many natural approaches that can be taken to help these issues, and this is primarily what I do with people with Alzheimer's, with dementia of various forms, even just simply with some memory issues. All of these can be helped with these kinds of precursors or inhibitory substances, etc. So the natural approaches go there, and there are other approaches that I can take as well to enhance the activity in those areas. So I don't just do kind of a hands-off, here, take this and see ya. In some cases I may do that, but in others there are approaches that I've been using that work in conjunction with providing the nutrients that the body needs to produce those neurotransmitters. And as an example, I've been using some electrical stimulation of certain brain areas from the outside on the cranium, on the outside of the head, at certain points that are defined in Chinese medicine. There are some points that are very, very valuable for increasing brain activity and increasing specifically memory and other kinds of cognitive activity. In other words, for example, I mean, one of the claims is, I can't point to any studies to back this up, but one of the claims is that some of these points can actually raise somebody's IQ. But what I have seen personally is that people have been changed dramatically by these therapies. I mean, I have this, for example, this elderly lady who started coming to me with real difficulty, first of all, remembering her appointments, real difficulty remembering why she had the appointments, and had a lot of anxiety, and the anxiety was getting in the way of much of her day. And then, but the anxiety had some reasoning behind it because she was losing her memory and she was having trouble coping. So the anxiety was built up because she wasn't sure if she could do a lot of things that she used to be able to do. And so I started to treat her, first of all, with the approach of simply providing the precursors, then enhancing that approach by providing a combination of precursors and some natural acetylcholinesterase inhibitors. And that combination got us so far. And then I started working on her with acupuncture, and that got us so far. And then I started to adjust the acupuncture treatment to use an approach that is kind of a groundbreaking thing, at least for me. And I don't think there's a lot of people, if any, doing this, but basically using electrical stimulation to help to stimulate those same points that I was using acupuncture for. So it's kind of electroacupuncture, you could say, that I've been using. And it's been working amazingly well. Like this, I want to call her young lady because she's full of energy, even though she's very elderly. And she turned around dramatically. Like she was having to write everything down, everything. Her memory was really troublesome. She would have to write everything down. She couldn't keep track of anything. She couldn't have regular conversations because she couldn't remember half of the things that were being talked about. It was just dramatic. When I started doing these treatments, she started to get through her days without writing anything down. And just totally, I mean, everything was fine. She was getting by great. And her family was commenting how dramatic the change was for her. It's just quite a sight to behold when somebody turns around this well with this combination that I've been using for her, and I've been adding to other people's therapies as well, including in areas that are diverse from that, such as stroke. You know, stroke issues, affect neurology, affect energy level, many things. And I've been working in that realm with this technique as well. And for other people who've simply been, having memory issues and others who have more of a dementia issue. This applies to another elderly lady that I'm thinking of right at this moment. And we've really seen some great improvements there. But this particular one I just mentioned is just the most dramatic. I mean, it was like flicking a switch, and somebody turned on the lights, and that's basically what happened. I was sort of turning on the lights by using the electrical or electroacupuncture, in specific brain areas from the outside of the head, treating on her head, on these points on her head, and her brain just woke up. You know, everything just started to click and everything got better. So I've seen these kinds of results, but I do a lot of groundwork. I'm treating not only the symptoms, although to a certain extent I am treating the symptoms, but that's not my primary treatment approach. The more fundamental aspect of it is that I'm focused on the cause, not just the symptoms. I may, while I'm treating the cause and while I'm searching for the cause and while I'm addressing the cause, I may do other things too to find out the underlying cause and really isolate it. You know, certainly lab work, blood work is a part of that. In some cases, it may require ultrasound or MRI or other forms of lab work, or even a hair analysis to understand what's going on inside the body. And of course, a hair analysis can give me a lot of valuable information as well, because I can tell some of the nutrients that are deficient, not in the blood, not just floating around in the blood, but deficient in the tissues. And if these deficiencies are present in the tissues, then they're really significant in terms of, you know, having the nutrients that are involved in the metabolic processes that are required to produce what is normal function. So you can't get normal function from somebody who's, you know, all of their nutrients are out of whack. You know, if people are out of balance in their nutrient levels and they don't have the proper coenzymes, say, for certain processes, which are what vitamins are, really, coenzymes, and you know, or they lack certain minerals that are vital to certain processes, like zinc and selenium are very key ones. Copper can be, iron certainly is. So, but glandular function, manganese, magnesium, you know, there's a lot of these kinds of things, and if they're not available appropriately, then how can somebody improve, you know? So, you know, I guess in a way that's one of the values of conventional medicine, because the treatments in conventional medicine kind of ignore quite often the underlying causes and just treat the symptoms, and which works great when you're talking about somebody who's on death's door and they need to be recovered, you know, just brought back to life, basically, or to be able to function. But it still leaves people with the absence of the needed nutrients to thrive. So you can't thrive simply through symptomatic treatment. And so what we see is quite commonly, you know, this kind of unending decline while people feel better, essentially. You know, you see improvement on the outside, but what's going on the inside? You know, you still have those imbalances that created the problem in the first place, and they have not been resolved. So those imbalances continue to further evolve, perhaps, while there's no evidence of it on the outside. It's going on the inside. So that's why we need to be focusing on the root cause, not just the symptoms. And I'm actually seeing more and more nowadays. I've been talking about this stuff for a long time and been involved in doing this kind of medicine for a long time. But I'm seeing more references to this kind of thing, even in pharmaceutical ads now. I'm starting to see some references to treating the cause. It's still a rare thing to see that, but I'm starting to see that a little bit. So somebody's getting the message. But, you know, that's the core of it. And if we're really going to make progress in these areas, we have to look for the underlying root cause. And some of it may be as simple as nutrient deficiencies. And so I do this kind of practice, and I'm just going to try and focus on memory and cognition and anxiety for this particular show, but there are many areas that I treat by approaching the underlying cause, addressing the underlying cause as opposed to just the symptoms. In fact, that's generally my approach. So, when we're talking hormonally, I look for precursors to the creation of the hormones. I look at those levels to see, okay, are these people low in the production of precursors derived from cholesterol, by the way, that allow them to produce the hormones, So it's not just a matter of stimulating hormonal production. If you haven't got the resources to produce those hormones, how's that going to work, So you have to look at the underlying precursors, the nutrients and other substances that lend to the creation of the hormones, just like we do for the creation of neurotransmitters. And many areas this works great in. There's so many things, and I'm really trying not to get off track from memory, cognition, and anxiety, which are all somewhat interrelated. So I'll just go back to that. So let's talk about anxiety a little further. So anxiety may be simply induced by the fact that somebody's starting to lose their memory and then getting anxious because they can't trust themselves, they can't trust their memory, they can't trust their thoughts. They may not be thinking as clearly, they may not be able to make snap decisions anymore. Think about that scenario when you're driving and something suddenly happens and you don't have the wherewithal to react. So an accident occurs, So especially for elderly people who are losing their faculties somewhat, that can be a problem. And so some people really fear getting behind the wheel because, and rightfully so, they're not functioning properly and they're not able to make the decisions and the choices that need to be made to drive cautiously, carefully, and responsibly and not risk the lives of themselves or others. So hopefully, in what I'm doing, I help people be able to continue those basic life needs or skills, allowing them to continue to drive, to continue to function well enough to do so and without risking the lives of others as well as their own. And help them just get through daily life, functioning with being able to keep track of whatever tasks they may have in their day, and be able to continue having those conversations with relatives and friends, and to continue dealing with issues that come up in their lives and this kind of thing. I mean, a long time ago, I decided to get into like an early decision, in the sequence of decisions that get you somewhere in terms of a choice of profession or any of those things. One of my early decisions was I was going to use my brain because, the body might fall apart, and the body might start to get worn out, and we can certainly address those issues as well, by the way. I could get deep into that subject as well. But those issues can be addressed. But a common scenario is that people tend to lose some functionality, some ability to use their bodies to the extent that, say, a young man can or a young lady. And so sort of an early decision for me was that I was going to use my brain because, my body could fall apart, but I'd still be able to function in my profession if it was using my brain. Then secondary to that, to be able to continue my profession and to help people. And as you can see, I'm performing a lot of those objectives for myself. And that also meet the needs of others. And, you know, yes, I do have a lot of passion for what I do, and I try to help as many people as I can. And I try to help them in ways that they may not have been helped before, and quite often are not. Because I don't know, it's a passion, because I really want to help people. I really want to help. And I'm also very, very well trained as a troubleshooter, as a scientist, as you know, somebody who researches a lot. I've done a lot of research. I do a lot of research. PhD work requires a lot of research. You know, it's not simply reading a book. You know, in most education, it's pretty much a matter of reading a book and understanding the content, and then being able to repeat it, and then do some investigation. And in the more scientific areas, then there's additionally the research and further research and understanding underlying issues and structures and things like that, and function. But when you get to the PhD work, research is extremely important, and a huge part of what is done to accomplish the level of work that's required to do a PhD. And so that kind of focus, one, keeps my brain active, keeps me aware, and keeps my memory pretty good, and my cognition, my ability to think, these kinds of things, very highly functional, I think. And I think that's an important part of doing what I do, because I use not only my knowledge, but also my thinking ability, my ability to ferret through the information and pinpoint the key issues that tie in to whatever health issues an individual may be having, and tie them together in a holistic fashion, so that I'm looking at all of the factors, or as many of the factors that I can gather, that then tie into the underlying issues that are involved in whatever health situation they may be addressing or may be dealing with. And that is a holistic approach. I mean, that's looking at the whole person, whole body, and their life, and all of their influences, and all of the things that are important to internal medicine as well, in terms of you know, what affects their internal processes, what affects their physiology and anatomy, and how that all ties into affecting the end result, which may be an issue that they have been dealing with for quite a while, and affects their health, their thinking, their emotions, their happiness, their wellness overall, you know. And, you know, some of these are simple things like exercising, like keeping active, and that there comes in many forms, especially nowadays, from everything from yoga and you know, certainly you know, getting on a treadmill, or getting on an elliptical machine, or bicycle, or you know, doing Tai Chi or Qigong, or there's just many approaches, many ways, and of course weightlifting is another part of that. You know, doing weight-bearing exercise can be important, but it can also be harmful. You've got to be careful about your particular situation. You know, somebody who has you know, degenerative disc disease, or has bulging discs, or you know, these kinds of issues probably should be avoiding weight-bearing exercise to a certain extent, or at least doing it very moderately so that they don't do further damage. Or if they have joint issues where they're carrying the weight and it's affecting their joints further, you know, these kinds of things. So we have to be careful about exactly which exercise is being done. But by the way, that is another factor when it comes to improving memory, cognition, and even anxiety levels. Exercise can be an important factor. So, you know, exercise helps us use up cortisol and adrenaline. It helps us to dissipate it. It helps us, our bodies use it up so that it's not ever present, causing problems throughout our bodies. So that may also affect anxiety levels. That may affect moods as well. But getting that blood flowing, the exercise, especially cardiovascular exercise, gets the blood flowing and improves metabolic function to a certain extent and helps to increase cognition. It increases brain activity. So it can help us in those ways. And all of these situations can work together, you know. So we have our nutritional needs that are often precursors to our brain function, to our mood function as well, to our hormonal function, to our metabolisms, to our metabolic, you know, actions that are occurring, you know, the activities of our thyroids, our adrenal glands, etc. So we have these nutrient precursors, which I've discussed a lot of on this show. Then we have other factors that can be involved in terms of maintaining normalized or normal levels of brain activity, of neurocognitive kind of activity, in other words, thinking and neurological activity that help us stay bright and aware and alert. I think one of the better examples in my life, my personal life, has been that of my grandmother. My grandmother lived to be about 98, and there was an undetected thing going on inside her body that basically led to her kind of suddenly going away on us. But she lived to be 98, and she continued to, into her elderly years, even after she had gone virtually blind. She was even at that point still doing crossword puzzles. She could hardly see them. She had to use a very large lens and this kind of thing. But she was doing those crossword puzzles every day. And she was keeping her brain alert and aware. She was reading newspapers. She was listening to, you know, radio shows on all the things going on in the world and trying to keep active and alert. And she was always very interested and energized. And she's a lady who very, very, very rarely took any drug. Very, very rarely. And only under extreme need, basically, would she ever take anything like that. And so she lived to be 98 and was a very good example of this. She was sharp as a tack at 98 years old. Had no memory issues whatsoever that at least I could detect. She was very sharp, very bright, alert, and aware, and could show me such insight into so many things in life and in her own life and in just daily living and decisions to be made and so on. Just that's the kind of thing I want for everyone. It's so that you're living a very high quality of life as long as you're around, you know, to where we can see a very high quality of life for all of us. And be able to function optimally into our late years, and just do well, and be well. So hopefully we've touched on a lot of subjects that relate to the underlying issues involved in memory, dementia, cognition, thought processes, anxiety, all of these things that kind of interact and can affect each other. There's one other that I could throw in there, and that's depression. Quite often anxiety and depression are kind of two sides of the same coin. But all of this can work together and they all affect each other. But many and most of those issues can be rooted in getting the right nutrition, addressing some of the things that are going on in the body, the brain, and then anything that may affect that and improve it, we work on doing. And that can be various treatments, that can be exercise, that can be practice, such as I was mentioning with my grandmother, with crossword puzzles, etc. There's many things that can be done to help enhance these things. And I've seen some amazing results by doing all of these things. So the hope is there. There's a lot that can be done. So I hope that was a memorable group of concepts for you, and I hope that we can continue to pursue some of those issues, and that you liked listening to the show, and that we can continue to enlighten people on many of these issues, and that you can see that there's lots of hope for improvement if you're having issues like these. So thanks for listening. I do want to mention that the next show I'll be having a guest. Her name is Stephanie Lazat. She is with Designs for Health, which is a company that produces a lot of the things that I use to help to treat individuals. It's a GMP company. There's a lot of regulation in these things, unlike you will often hear from conventional people who poo-poo a lot of these things and want to put them down and tell you that you don't really know what's inside them and this kind of thing. That's hogwash, by the way. They're well tested and so on. So all of these things are used to help us make progress with individuals with many of these issues, and this particular company is one of the choice ones that I use in various therapies that I do for people. And anyway, we're going to have her on as a guest next week. So you've been listening to The Path to Wellness on rhinoonair.com, WSPF-DB.com. And I'm Dr. Christopher Jackson, PhD, DOM, Florida. And my practice is by the same name, A Path to Wellness. You can reach us at 727-329-9637. Or you can take a look at our website at APTW, short for A Path to Wellness.net. So aptw.net. We'll talk to you next time.